Hello everyone, I'm Dr. Zarra'i Abdelrazak, neuroimaging scientist in the research laboratory of biophysics and medical technology of Tunis at the University of Tunis Al Manar. Today in this presentation I will explain the utility of diffusion tensor imaging on stroke. You have likely heard the term strokes before. Over 13 million people will have a stroke each year, and around 5.5 million people will die as a result. Strokes happen in two ways. In the first, a blocked artery can cut off blood to an area of the brain, and this is known as an ischemic stroke. 55% of strokes are of this type. Second type of strokes happen when a blood vessel can leak or burst, so the blood spills into the brain tissue or surrounding the brain, and this is called hemorrhagic stroke. Certainly, proper treatment can reduce brain damage and the likelihood of death or disability. In 1995, the 9DS study group reported in the treatment with intravenous TPA within 3 hours of the onset can effectually improve the patient neurological function and the results of the favorable outcomes. Potentially technical advances in neuroimaging offer new promise to provide information about the situation which may guide treatment outside the time window. Imaging technique of magnetic resonance imaging such as diffusion tensor imaging has emerged as a promising tool to study acute stroke. DTI has shown to be capable of delineating the microstructure change of brain due to the ischemic stroke in the damaged area, expressed, for example, by fractional anisotropy. Here is an example of six diffusion weighted encoding direction. We know each image has a slightly different contrast that correspond to the orientation of the wave matter relative to the difference encoding, combining this image to estimate the diffusion tensor at each voxel location. Quantitative diffusion imaging tensor imaging maps may be generated that provide descriptive measure of brain tissue microstructure. In addition, the diffusion tensor may be used to estimate the trajectory of the white matter fibers in the brain using certainly the tractography technique. There are different types of diffusion tensor imaging data analysis method. Among these methods, we cite analysis of region of interest, which is based on the extraction of information like fractional anisotropy, mean diffusivity, radial diffusivity, axial diffusivity, uh, area of the brain. This method depends on the position and the size of the ROI and needs a knowledge of anatomy and a priori hypothesis. The other method is the voxel by voxel analysis, which can identify the difference in the local tissue composition at the scale of the whole brain. It's a highly reproducible and depends to the spatial normalization. The last one is the tractography, which aim to calculate the volume of a tract and the number of fibers across a region. This method requires assumption a priori on a fiber bundle. The evolution of the different diffusion parameter in ischemic stroke is important in determining the sensitivity of each to quantify neural damage and the inference in its relation to future outcome. FA and MD per ADC map and ID and RD depends on spatial organization and fiber density and also vary with age. Green matter, which is slightly more anisotropic than TSF, has an fractional isotopic diffusion of 0.05 to 0.25. Diffusion value in way matter vary the most depending on the number and density of local fibers. For example, the average of fractional anisotropy of the corticospinal tract is around 0.5 to 0.55. The diffusion parameter in ischemic lesion with 30 minutes of visual occlusion following stroke cytic edema leads to an inflow of white matter into the neuron, increasing intracellular fluid and therapy decreasing extracellular space. In fact, the decrease in ADC per MD at this period stage of stroke inferior at 7 hours is driven by significant decrease in AD of 37% and RD of 45% with respect to the line of base. The greater decrease in RD versus AD leads to an increase in fractional anisotropy. One of the aim goals of stroke research is to be able to predict outcome futures as soon as possible, even as early as 24 hours after the stroke. Post-stroke motor recovery depends on several factors, including location and the volume of the lesion. Finally, the acute and early subacute phase is characterized by an increase in radial diffusivity. Diffusion tensor imaging used to characterize Valerian degeneration. The decrease in the FA provides useful prognostic information. Thank you for your attention.